What is your opinion of the use of psychiatric meds in children?
Criminal, totally
Mm.
criminal. It's, I'm not anti-sympathetic to the behavioral issues that parents might have and how devastating and heartbreaking it can be when you're trying to connect with your kid and you can't. That's
Mhm.
not what I'm talking about. But, the fact that you can prescribe a stimulant as young as 3 years old and that's approved is literally insane to me. The frontal lobe doesn't even finish developing until age 20, 25. So, to me, it doesn't make any sense because there was a bill that was almost passed and it didn't get passed. This was like 15 years ago in the US. And they said, we're seeing alarming rates of people with schizophrenia having celiac disease and some people having resolution of all symptoms with a gluten-free diet. So they said, how about before people prescribe an antipsychotic, we have to do a test for celiac first. And the bill didn't pass. And I thought, why don't we do that with children? Like when I have pediatric patients, I'm always looking and I'm seeing things that, we didn't maybe always see before, and there's a lot of reasons for that, but I am seeing hormonal problems in children now. Like I've got an infant right now with the hormonal issue, her thyroid issue. I've got another kid, he's 10, making no testosterone for his age demographic. So we have to look for these things first before we suppress the symptoms, because if you are lucky enough to have a child that is telling you, hey, and so many words, I got something wrong, like I can't focus, I can't sleep, I got nightmares, I'm wetting the bed, like I'm yelling, I'm throwing things, then let's figure out why before we just try to turn the volume down on that. And so I think there's potentially long-term consequences. I have a lot of patients right now that are in their 20s that have been on a stimulant since they were children, and they don't know what life is like without that. And so coming off it is not a fun experience because that level of fatigue coming off a stimulant is unreal. So I really do think it is criminal that prescribers do that.
Well, and here's the other thing too. As you mentioned, your brain is rapidly changing